Yo, yo, yo. Hey guys, welcome back to another amazing edition of the Best Practices Show podcast. It is Friday, everyone. Hope your week's been a good one. And every Friday, our job is to challenge the clinical edge you bring to your patients, give you some thinking to help you elevate how you take care of those amazing patients in your practice. And we're going to do just that with a dear friend of ours, Dr. Bradley Bale. You might remember him from Beat the Heart Attack Gene. He did a masterclass recently that was so good called Avoiding the Chronic Diseases of Aging, the critical role of oral health. It was so good, I thought I would share the audio on the podcast. So here it is. I hope you guys enjoy it. And we'll see you soon.
Today we have the pleasure of learning from Dr. Bradley Bale, a nationally recognized expert in cardiovascular disease prevention. Dr. Bale serves in multiple academic roles. He's a clinical associate professor at the WSU College of Medicine, an associate professor at the University of Kentucky College of Dentistry, and an adjunct professor at Texas Tech Health Science Center. In addition to his academic work, he runs a private practice in Tennessee. Dr. Bale is one of the country's top specialists in preventing heart attacks, strokes, and diabetes, and he's best known for co-founding the groundbreaking BaleDoneen Method with Amy Doneen in 2001. This method, focused on personalized cardiovascular risk assessment and management, has been shown to halt and even reverse arterial disease. His work is widely published in leading medical journals. He's also contributed as a reviewer for esteemed publications such as the American Journal of Cardiology and CDC's Preventing Chronic Disease. In addition to his research and academic contributions, Dr. Bale is the co-author of two best-selling books, Beat the Heart Attack Gene and Healthy Heart, Healthy Brain, the latter of which won the 2023 Gold Nautilus Book Award and the ASJA June Roth Memorial Award for Outstanding Medical Book. His insights and expertise have transformed the way we understand and approach cardiovascular health. And we're just thrilled here at ACT Dental to have you join our Best Practices Association and speak today. And I'm so happy you just said yes to me.
Thank you, Angela. Yeah.
Welcome.
Appreciate the introduction and excited to present this program today. I mean, it's always exciting when we can spread the message. There's a cure for arterial disease. You know, it's the most common pathology in the human body, and there is a cure for it. So we're going to discuss that. And that's the way you're going to avoid all the chronic, or a lot of the chronic diseases of aging. And in arterial disease. So I'm happy to be here, happy to present this program. Thank you, Angela, and thank you, Kurt. I'm sorry his father-in-law apparently passed and he had to run off for that, but I appreciate both of you helping to get this set up. And Angela just went over my academic appointments, so we don't need to cover that again. And I have a question for everybody listening in, and to see if you made a good decision to come to this program today. And the question is whether or not you know anybody who's had a heart attack, had a stroke, has diabetes, dementia, Alzheimer's, heart failure, kidney failure, erectile dysfunction, macular degeneration, or peripheral arterial disease. If you know anybody with any of those conditions, raise your hand. Yeah, you made a good decision to be here today. And I want you to keep those hands up if any of those people were family or friends. So my guess is everybody listening in to this would have their hands up. those are so many common diseases, but the great news is they're all preventable. And that's what we're going to talk about today. But I would like to dedicate this program to all those family and friends that you do know who've had any of those conditions. And what's the latest stats with those diseases that we talked about? Well, heart attacks still are the number one killer. They've been the number one killer for 124 years. And 14% of the people who have one die immediately. 35% are dead within a year. And what's kind of scary, the incidence of heart attacks in adults under the age of 40 has been steadily increasing about 2% annually. So it's not just happening in older individuals. Stroke is still the leading cause of disability. And if somebody has a stroke between the age of 20 and 60, they're 2 times more likely to be a female. They have a much higher incidence in that younger age. Diabetes, we all realize that's arguably the fastest growing disease in the country. 35 million Americans have type 2 diabetes, and about 90 million of them are undiagnosed. And I put this slide in this morning because this just came out earlier today, and I saw it this morning. So I thought, hey, let's fit the program. Let's make a quick slide on it. They looked at 46 million English people, and they looked at ones who had type 2 diabetes, and they found that those individuals had the onset of chronic diseases such as arterial disease, cancer, hypertension, depression about 20 years earlier in life. And they spend about 20 years of their life with those chronic diseases, and they die 11 years earlier. So nobody wants to become diabetic, type 2 diabetic. And the great news is it's all preventable. The reality is about 1 out of 3 adults are pre-diabetic, and only not 1 out of 10 realize it. So that's kind of scary, because it's hard to prevent if you don't know you're headed there, okay? One of the tricks to preventing diabetes is realizing, oh my gosh, I'm on my way there. I've got to do something to turn this train around, because you can always do that. And we do know now the average lifespan for an American is about 79 years. In the last 13 years of their life, they are living it with chronic disease, and they're not healthy. So they're not having a great life for the last 13 years. So what are a lot of those diseases beyond heart attacks, strokes, and diabetes that rob people of their health? They're dementia, peripheral arterial disease, macular degeneration, erectile dysfunction, kidney failure, heart failure. What causes these diseases of aging? It's caused by microvascular disease. The tiny arteries, the capillaries where the exchange of nutrients and the removal of waste occur, get damaged, and that leads to all those chronic diseases of aging. Microvascular disease is becoming much more appreciated due to its prevalence and relevance to all those chronic diseases we mentioned. And it's felt that microvascular disease is the main underlying pathology for all major medical and neurological conditions. So here are references to back that up, what I just told you, all those diseases being anchored and due to microvascular disease. So the logical question is, okay, well, what causes microvascular disease? Well, it's anchored in the sound of silence. So what do we mean by that? Many cardiovascular events, like the heart attacks and strokes, are actually silent. And those asymptomatic events end up causing microvascular disease. So as we're going to discuss in a minute, what blocks the flow of blood's a clot. And when you have a heart attack or stroke that you're aware of, it's a huge clot. So it blocks the flow of blood enough you're symptomatic. But what we now know, at least half of all these events, the clot's really small. Doesn't cause any symptoms. But then it breaks loose and it travels downstream until it gets stuck. Well, where's it going to get stuck? It's going to get stuck in the arterioles and the capillaries where that important exchange of nutrients occurs. So some cells are going to die, but not enough where you have symptoms from it. But if that continues to happen year after year, eventually, yeah, you're going to have symptoms like, what day is it today? What am I doing here? I can't walk up a flight of steps because I got heart failure. I got to go plug into a dialysis machine because my kidneys are shot. I can't get erections anymore. I'm going blind from macular degeneration. So eventually, yeah, you do get symptoms. But the good news is we can keep the arteries healthy throughout our life. And if we catch it after you've already got disease, yes, we can shut it down and we can reverse it and stabilize it. We published that 10 years ago. And it's now being recognized that real world evidence is very important in figuring out a lot of these issues. The use of that type of evidence to evaluate the efficacy and safety of medical interventions is gaining interest. Because with randomized controlled trials, they're frequently, you can't generalize those to the real world in a clinical practice. Many unanswered questions in medicine involve multiple variable interventions in an individual patient. Answering such questions is not feasible in a randomized controlled trial. Real-world evidence allows the application of complex management within an individual patient as opposed to applying a limited, isolated intervention to a population. That's what you do in a randomized controlled trial. So it's now recognized that real-world evidence is needed to bolster the knowledge deficiency from those randomized controlled trials. So let's look at the real world evidence with the BaleDoneen method. This study was done by Texas Tech. They looked at 576 patients treated with their method over 8 years, mean age 55, about a third were female. And the primary outcome is what happened to the arterial disease as measured by the carotid IMT. And what they found was the intimomedial thickness, which is where the disease builds up in the wall of the artery. Over that 8 years, that thickness shrunk. Well, that's contrary to normal biology. Usually it increases. And then the next line is the actual disease itself, PLAC, cats in the gutter, atheromas. What happened to that disease over 8 years of time? It shrunk. So they concluded the findings suggest the BaleDoneen method is effective at generating a positive effect on atherosclerosis by achieving regression of disease. Well, hey, that's all great and that's nice and that's fun to see, but it's also important to ask the question, well, wait a minute, what really is the risk factor from disease to cause the heart attack or stroke? And we know the answer to that now from these 3 prospective excellent trials. It's how rich the plaque is with cholesterol. It's lipid richness that determines the risk if you're going to have an event from the disease you have. The more lipid that's in that disease, the greater the risk you're having an event. So Johns Hopkins, the head of cardiology there, has been a fan of our method forever, Dr. Stephen Jones. So he was begging for data that his cardiology fellows could analyze. So we were able to provide him with data on 324 patients that we treated over 5 years, and they analyzed the quality of the plaque, and they were blown away with their finding. At the end of 5 years of treatment, there was 0% lipid-rich plaque left. 0%. 0%. And it's lipid richness that determines whether you have an event. So that kind of takes away the mystery. How come our patients don't have heart attacks and strokes? Because this happens to their disease. So they concluded the results show the beneficial effect of the BaleDoneen method on vulnerable arterial disease. So the BaleDoneen method is a cure for arterial disease. Some people, their knee-jerk reaction is, well, that's impossible. Oh my gosh, if you had a cure for arterial disease, every healthcare provider on the planet would be doing it. Sadly, that's not true. It usually takes decades and decades for something to be adopted widely, and it turns our medical system upside down. In our country, you're rewarded for treating end-stage disease. You're not rewarded for prevention. So the money is made when people do have to go get dialysis, when people become diabetic, when stents are needed, or coronary bypass is needed, or a heart transplant's needed. So there's not a big financial motivation to adopt this cure for arterial disease, but it is gaining traction, and it will become the standard of care someday, believe me. And you can help make that happen sooner than later. So appreciate you being here today. So how is our method different from the standard of care? Well, the standard of care still rests on looking at risk factors in individual patients to decide whether or not they should be managed. Where our method from the get-go is on a platform of, we're going to look to see if they have disease. And if they have disease, yeah, they need to be managed. And that platform of looking for disease is held up by a very powerful arch, the acronym of which is EDFROG. Education is important. Looking for that disease, assessing for inflammation or fire, looking for the root causes of why there is disease, providing optimal management of any control of risk factors, and anchoring the results in genetics for that individual patient. That's why our method works. So we'll take a look at some of these elements a little bit closer. Education, as Nelson Mandela said, it's the most powerful weapon you can use to change the world. And it's extremely important for our patients to get educated on arterial disease and what actually blocks the flow of blood when somebody has one of these cardiovascular events. And it's amazing that there's still a lot of people who believe it's the gradual buildup of cholesterol in the wall of the artery. The disease that forms there just keeps getting bigger and bigger and bigger. Finally gets so big blood can't go by. That's what a lot of people still believe. We've known for 40 years with that study you see below that no, it's a clot that blocks flow of blood. Usually the disease in the wall of the artery is not blocking anything. It's a clot. So that's extremely important to go over that education with the patient. That education understanding is absolutely critical. So when we talk about cardiovascular events, what we mean is, number one, you have to have disease, atherosclerosis and atheroma, PLAC in the wall of the artery, and then you have to form a clot above that disease. So an atherothrombotic event is really the proper medical term for what we've been talking about. And again, they can be noisy, deadly, and they can be silent and go on and lead to all these chronic diseases of aging. So what do diseased arteries look like? Well, we've known for a long time, 20 years, that most all the disease, when it collects in the wall of the artery, it grows away from the hole. So it's not even in the hole. So 99% of it grows away. So you're not going to see it when you do an angiogram. You're not going to see it if you're trying to see with a stress test if somebody has disease. It's not going to work. So here's a clear example of that. You can see the disease here in the wall of the artery. That's a cholesterol buildup, the atheroma. And the artery is wide open. So we call that, when you have disease, the setup. So to have risk for an atherothrombotic event, you have to have the setup. It's that simple. So we nicknamed that setup years ago the cat in the gutter. That's because Amy and I were in Rome, Italy, in a plaza, enjoying watching the people feed the pigeons until we saw cats slithering into the gutter low enough that the pigeons had no idea. And one of them would walk over close enough and boom, all of a sudden that pigeon's a meal. And we looked at each other and said, you know what? That's exactly like arterial disease. It's sitting in there. People have no clue it's there, but all of a sudden it can leap out and cause a devastating clot. So that's why we nicknamed it Cat in the Gutter. That's our cartoon rendition of that. So what causes the clot to form? The inside lining of the artery, known as the endothelium, we nickname it for our patients a tennis court. So we tell them, look, all your arteries are lined by a single layer of cells. Yeah, it's got a fancy term called the endothelium, but you got about 30,000 miles of arteries in your body. If we took out all those cells, single cells in your body from your arteries, we could cover 3 or 4 tennis courts. So we call it the tennis court. So the tennis court sits over the top of the atheroma, the cat in the gutter, the plaque. And to have an event, that tennis court either has to break with a rupture, or it has to erode, where you spot on have some death of tennis court cells, and the result will be a clot. So that's the punch. So to have risk, you have to have the setup. To get punched, you have to have that failure of the tennis court. And here's a clear example, autopsy example of a fatal failure. You can see where the cholesterol was in the wall of this coronary artery, and it wasn't blocking the flow of blood. There's plenty of room for blood flow, but the tennis court broke here. The clot formed. It was so large, it forced its way into the space where the cholesterol used to be, and the person died. So that's an example of a rupture. Here's another fatal autopsy picture. When they cut the artery, part of the clot fell out. It totally blocked the flow of blood. You can see this is a cat in the gutter here. It's still there. There was not a rupture of the tennis court. The tennis court eroded, and you got this fatal obstructing clot. And this next one should really scare you, because this is going on, and most people are not going to have a clue unless they're plugged into our method. And that's the silent one. So this is an electron microscopy picture of a clot that resulted from the death of a single endothelial cell. Think about it. That heals, that clot peels off, travels downstream to your capillary. If it's in the heart, you're going to lose a few heart cells. You won't know it. If it's in the brain, you're going to lose a few brain cells. If it's in the kidneys, a few kidney cells, etc. So those are happening to people all the time, and they're totally unaware of it. So this is just kind of a diagram of what we've been talking about with event reality. So here's the setup, the plaque in the wall of the artery. Then there's a punch with the endothelium getting damaged. Then you can get an totally obstructing clot that's symptomatic. And just as often, if not more often, you get a tiny clot that's asymptomatic. And those little clots will travel downstream and end up causing microvascular disease down the road. So the bottom line is, the critical thing for patients to understand, it's not the buildup of cholesterol in the wall of the artery that blocks flow of blood. It's a blood clot. And we've known that for 40 years, but it's amazing how many people still think it's a cholesterol buildup. So I'm going to play just a quick video to illustrate what I'm talking about. So we're going to go into 3 coronary arteries. And the first one you're going to see is going to be totally normal. There's not going to be any setup present in this artery. And white blood cells, and the yellow stuff's supposed to be cholesterol. When you get to the cross section, you're going to see there's no setup. There's no disease. You can't have an atherothrombotic event from that. Okay. This next one, when you get to the cross section, yeah, there's disease, but it's been cooled off. The white blood cells, the inflammation is staying in the flow of blood. It's not going into that plaque. There's a huge layer there from the plaque to the endothelium, so it's not likely for the endothelium or tennis court to rupture. Now, this one is dangerous. You see this setup, and you see all the white blood cells pouring into that disease, and that produces matrix metalloproteinase, which will weaken that tennis court to the point it can break. And as soon as it breaks, you're going to form a clot. That's what happens. And that's why a stress test is not going to pick up something like that. So, but the interesting thing is we've had that knowledge for 40 years. But, okay. So moving on with our EdFrog acronym, should I be treated? Well, the standard of care says, well, we'll find out. How old are you? Are you male or female? What's your cholesterol? Do you use nicotine? Some of them use CRP, the inflammatory test. Sometimes they even ask about family history. But we're going to plug all that in a calculator, and it'll tell me if you need to be treated or not. Don't worry about it. Or you can do the BaleDoneen Method and say, we're going to look to see if you have a cat in the gutter. So if you got a cat in the gutter, you got the setup, you need to be treated. This was from 12 years ago in the American Heart Association Journal. What did they say? They said arterial disease is essential, a condition sine qua non for having risk of a stroke or heart attack. Therefore, assessing for it is fundamental. Well, that's not what the standard of care does, is it? This was published 3 years ago, stating that risk assessment using traditional risk scores has been accepted for cardiovascular prevention for over 20 years. It remains the gold standard, even though its imprecision is well recognized and documented. So, do you have any questions now about why heart attacks are still the number one killer and have been for 124 years? I mean, it's a definition of insanity, right? I mean, it's crazy, but it's changing. So let me show you something that was just published 2 weeks ago. This is 2 weeks ago in the Journal of American College of Cardiology. 2 articles. What do they say? Traditional risk factors are imprecise in identifying who has atherosclerosis. Non-invasive imaging can detect these atheromas, which predicts cardiovascular risk. Image-guided therapy should be superior to risk factor-guided therapy. You just have to laugh. I mean, we've been doing it for almost 30 years, but this is good. Things are going to change. People will start adopting the BaleDoneen method because it works. It makes sense. So yeah, you got to look for disease, okay? It's not that hard to do if you find it anywhere. It's a systemic disease. So if you have an atheroma anywhere in your body, you're going to have risk. So you simply open up the chart. First thing you do is look at all the imaging reports. If any of them show calcified arteries, what do you know? You know you've got an atheroma, you have arterial disease, and that holds even for mammograms. So if a mammogram reports calcification in a mammary artery, we have studies that show, yes, those women, guess what? They're high risk for heart attacks and strokes. Of course they are. They've got arterial disease. And then in your bailiwick, you're doing panoramic imaging on your patients all the time. So here's a little cartoon of that. So you're looking at one of those images and you say, hey, the good news is, look, I can fix your teeth. But the bad news is you may have a stroke. So this is an image provided to us by one of your colleagues, Dr. Mike Rogers. You can see the calcification in the carotid artery there. And we have studies that tell us, look, individuals with that type of finding, 26% of them are going to have an event in the next 3.5 years. The only caution I would have to you, so now that you know that, I'm going to hide these little thumbnails, but the only caution I'd give you on that, and we've had feedback on this, so yeah, golly, I've had that finding. So I sent my patient to a cardiologist because I knew they were at high risk. The cardiologist did a duplex scan of their carotid, said it's wide open, put them on a treadmill, told them they passed it with flying colors. I don't know what the dentist is worried about. This is crazy. You're fine. You don't need treatment. So, and then you look bad. So if you have a finding like this, you need to find a medical provider trained in the BaleDoneen method, who's not just going to blow this off and end up implying to the patient, you're crazy, because you're not crazy. That patient is high risk and needs help. You can also identify it, of course, with coronary artery calcification. That test is becoming more and more widely adopted. We actually started using it 30 years ago and then minimized our use of it about 20 years ago because of the big weakness. If you have disease that's early, it's totally lipid rich, which is the most dangerous type. You're not going to see it on this. It hadn't been there stabilized enough to form calcium. So certainly if you have a positive score, yeah, you can sink your teeth into it. But if you don't, you still don't know that that patient doesn't have lipid-rich, dangerous plaque. So we migrated over to ultrasound to look for the disease with the carotid IMT because it's independent of calcification. So we're not going to miss it if it's there, whether it's calcified or not. And in this image, this is measuring the intimal medial thickness where the disease collects. And we have enough information to be able to tell us that thickness, it's equivalent for a man or woman for arterial age. So say a guy does a test, we look at the thickness of that IMT, and it's the thickness that we would expect in a 65-year-old male, and maybe he's 40. Well, something's going on. That's not a good signal. And certainly if you see a cat in the gutter like this plaque, well then, yeah, they got disease. They're at risk not only for heart attack and stroke, but all those silent diseases, chronic diseases of aging. So we published a paper a few years ago that's gaining traction, how the current classification for cardiovascular prevention needs to go from a binary classification to ternary. Currently, the system says if your primary prevention, it simply means you haven't proven by having an event or needing an intervention that you have disease. You have no idea whether they have disease or not. You just know they haven't had a problem. Secondary prevention means, yeah, we know you got disease, you proved it. What we need to do is migrate to this system where you look as best you can for disease. If you can't find it, that's a true primary prevention patient. You want to help them avoid ever getting arterial disease. If you find disease and they've never had a problem from it, that's secondary prevention. Obviously, they need management, and you're going to do everything you can so it never causes a problem. And then tertiary prevention, of course, they proved it the hard way. So hopefully everybody listening to this presentation knows which category you're in. This person knows that she has a setup. So then the question becomes, what I really want to know now, I got the cat. You showed it to me. Am I at risk to get punched, to have an event? So how are we going to figure that out? Well, that comes from the keystone of our arch, which is the inflammation, the fire. It tells us if the patient with a setup is at risk for an event. And now, finally, the controversy over inflammation being the cause of arterial disease and the driver of events is over. That ended several years ago with the publication of the study called CANTOS. So there really shouldn't be any healthcare provider out there now that doesn't agree. Yes, it's inflammation that causes arterial disease and causes events. So we finally got over that hurdle. For a long time, people argued with us, said, no, it's cholesterol. So cold arteries indicate there's no arterial disease brewing, and there's low risk for an event. You're not likely to get punched. If you have a hot artery and you have the setup, it could actually kill you, or with silent events, go on and cause chronic diseases of aging. So what are these important biomarkers that we utilize to give us this important information? There are two blood tests, F2-isoprostane, and the microalbumin creatinine ratio, and the blood tests CRP, fibrinogen, PLAC2, and myeloperoxidase. And we feel confident when we get the results of these tests, we can tell the patient if they have the setup. If all of these tests are great, you can look them right in the eye and say, look, there's no arterial inflammation. You don't have any active disease at this time, and your risk for an atherothrombotic event is extremely minimal. So 3 of the tests look at whether or not the tennis court is inflamed or dysfunctional, and that's the CRP, the fibrinogen, and the microalbumin creatinine ratio. And when any one of these 3 is a great result, you know that the tennis court's okay. Other things can throw these tests off. So, but with 3 of them put together, we feel confident we can get to a good assessment. Then it's important to know if it's inflamed in the intima. And we have a blood test for that, lipoprotein associated phospholipase A2, or abbreviated the PLAC2 test. And if it's elevated, it actually means the cat is growing and that it may jump out, because PLAC2 is not only a marker of inflammation in the intima, it's an actual player in the disease process. So when it's elevated, there's disease going on, and there is risk that the cat, again, is not only growing, but it could jump out. So it's an extremely important test to get control of. It's such a great test that the FDA 10 years ago cleared it as a screening test to predict someone's risk for a heart attack, whether or not you know you have arterial disease or not. That's a huge statement. I would ask each of you on this program to go look at your medical record and see what your PLAC2 level is. Unfortunately, my suspicion is some of you don't know what it is, because despite this statement, most doctors still don't order it. It's one of the most important tests that we order. And in your area of expertise, it's important to know periodontal disease is associated with elevated levels. And when you treat periodontitis, it'll lower the level. Then we have the blood test myeloperoxidase, which we nicknamed the Joker. And there's a simple reason for that. It's like in a game of cards, you may have all the chips in your corner, but then you get dealt the Joker and you're out. That's how important this thing is. Myeloperoxidase resides in eosinophilic crystals in white blood cells. And when you get an infection, the white blood cell tracks to the infection, releases myeloperoxidase into the tissue, and it kills the germs because it forms hypochlorous acid. But the hypochlorous acid also promotes activation of matrix metalloproteinase. So if you have the setup, you're more likely to have the rupture of the tennis court. And hypochlorous acid also can spot on kill endothelial cells, and that'll cause an erosive event. So it was published, 17 years ago, that when myeloperoxidase is elevated, even if every one of your other tests is normal, you got risk. If you got the setup, you're at risk for a heart attack or stroke or atherothrombotic event. That's how important this test is. And we found and noted an extremely strong association with endodontic disease over the years. We've been measuring this thing for over 20 years. So our experience tells us probably 8 out of 10 times when it's elevated, it turns out there's an endodontic infection. So we presented that observation to Dr. Stan Miller, who's at University of Kentucky College of Dentistry. So he did this study and got it published, where they looked at individuals with such infection, and then they looked at myeloperoxidase, they extracted the tooth, and what they found was 6 weeks after extraction, the myeloperoxidase decreased significantly. That p-value is incredible. You don't see studies with that type of a significant p-value. There's absolutely no question that's a direct relationship. And patients with higher baseline myeloperoxidase had larger reductions. So we concluded in this study, there's a link between dental infection and myeloperoxidase. Okay, well, let's move on. And I must say, I forgot to do it in the beginning, but I'm at the tail end of respiratory infection. So if I cough or sound a little congested, I'm sorry, but I'm getting better. I'm feeling good today. But I'm still a little plugged up. So now we're going to move on with this. I know how to prevent atherosclerosis by getting to the root of the problem. Now that is like a wonderful dream, isn't it? Well, let's take a look at it. Is it really possible? Well, the first step in avoiding a problem is to avoid the first step leading to the problem. That's pretty simple, isn't it? I mean, it's just pure common sense. If you want to avoid a problem, you don't want to take the first step toward it. You got to avoid that first step. So the question becomes, what's the first step in forming a cat in the gutter, an atheroma, a plaque, disease in the wall of the artery? What's the first step? We know what the first step is. You have to trap those cholesterol particles in that first layer, the intima, which is right below the endothelium. They have to get trapped in that layer to form disease. And a lot of people, that surprises them because they think the first step is, no, wait a minute. No, the first step, you have to get inflammation and dysfunction of the tennis court, the endothelium, so it allows those cholesterol particles to flow into the wall of the artery. That's what a lot of doctors still think, but that's not correct. It was published 12 years ago that the cholesterol particles are so tiny that they go right through a healthy endothelial cell. They go right through the cytoplasm. The only particles that are so big they can't get through a healthy endothelial cell are the ones that exist for a short period of time after we eat, basically. Those big chylomicrons, and the very low density lipoproteins. All the other cholesterol particles go right through a healthy tennis court. So if that's the case, what happens to them after they enter the wall of the artery? There's no cells in the intima. The intimal layer of the wall of the artery is devoid of cells. So they should pass right through it. Well, that's correct. Most all of them do pass right on through. Then they're so small they go through the next layer, the medial layer, the muscle layer. Then they get into the outside layer, the adventition. They go right on through that. So how can they get stuck in the intima? Well, they get stuck on something called a proteoglycan. A proteoglycan has a protein core, and it has polysaccharide chains on it. And those polysaccharide chains carry a negative charge. So what's that got to do with trapping these lipoproteins? A negative charge on that chain. Well, let's look at the structure of bad cholesterol. And this is LDL, IDL, VDL, lipoprotein A. All the bad cholesterol has woven within it this protein ApoB, which you can clearly see. It's in all the bad cholesterol. Here are the cholesterol particles in here. And to travel through the bloodstream, they have to be wrapped up so they can move through the blood. And all these particles, bad cholesterol particles, have ApoB. ApoB carries a positive charge. So what happens? The ApoB that has a positive charge gets stuck on the negative charge on the proteoglycan. That's how they get trapped. So then the next question becomes, well, what creates these proteoglycans? Proteoglycans are created from contractile smooth muscle cells in the media that get genetically transformed into migratory, secretory smooth muscle cells. So once they get genetically transformed, they migrate out of the media into the deep layer of the intima, and they secrete the proteoglycans. And one observation that's made years ago is if you find a smooth muscle cell in the intima, because again, the intima is devoid of cells, that's an area that's going to end up with an atheroma. So how do smooth muscle cells get genetically transformed? Well, it actually can be complex and related to a lot of unhealthy issues, but let's keep it simple and discuss by far and away the most common trigger. The most common trigger is what you see on that car, rust, which is oxidative stress. That is the most common trigger to cause that genetic transformation, which will then ultimately lead to trapping the cholesterol in the wall of the artery. Okay, wait a minute. What's oxidative stress? Well, oxidative stress occurs when reactive oxygen species are abundant relative to the antioxidants. So our bodies are constantly trying to balance this out, the antioxidants with the reactive oxygen species, but when it's tilted like you see in this illustration, that's oxidative stress. And it's a useful concept, despite the fact that its absolute value is constantly changing, and there's a lack of a universal measurement. We have measurements, but they're not universally adopted. The F2 isoprostane that we utilize does seem to be really good at picking up oxidative stress that results from lifestyle issues. But the science is definitive that oxidative stress is a significant facilitator of chronic degenerative pathologies, including cardiovascular disease. So how does oxidative stress change those smooth muscle cells? Oxidative stress activates platelets. Platelet activation increases platelet-derived growth factor. Platelet-derived growth factor is arguably the most common trigger to cause that genetic transformation. Once they're transformed, again, they move into the intima, produce the proteoglycans. You start trapping the lipoproteins. That's the first step in forming atherosclerosis. Well, then the next question, of course, is, well, what can produce this oxidative stress? This is an old cartoon from our method, all these root causes that we've been aware of for years that drive, you see inflammation in the trunk of the tree, and then you see the branches of the tree forming atheroma, and some of those atheroma are misbehaving and causing events. So those are root causes that we've been aware of for a long time. Well, it turns out, guess what? Every one of those root causes creates oxidative stress, every one of them. So I put in green ones that are in your area of expertise: sleep, low vitamin D, autoimmune diseases, periodontal disease, lipoprotein remnants, that's like the triglyceride part of the cholesterol measurement, hypertension, psychosocial issues, insulin resistance, infectious diseases, which would include your endodontic disease, air pollution, nicotine, gut dysbiosis, that myeloperoxidase, poor diet, lack of exercise, and then there are genetic factors that we measure that can influence oxidative stress, radiation, and probably the most recent one to be talked about and papers published on are the nanoplastics. But wait a minute, we were told inflammation causes arterial disease. Now you're confusing us. Now you're talking about this oxidative stress, and earlier you told us it was inflammation that drives disease and triggers events. What's going on? Does the trapping lead to fire? Could that be what's going on? Absolutely. When you trap the lipoproteins in the intima, they become oxidized. That turns on our immune system, which activates white blood cells that release all those pro-inflammatory cytokines, and they produce monocyte chemoattractant proteins, little proteins that pop up on the tennis court to trap more white blood cells to come down into the intima to try and clean up this mess. So arterial inflammation is actually a protective mechanism attempting to remove the trapped lipoproteins from the arterial wall to promote healing. So from a little spark, you may get a big flame because ApoB is what gets trapped. It's the fuel for the fire. And if it continues to be trapped, you're going to have a dysfunctional amount of inflammation that's dangerous and can lead to the formation of an actual plaque and lead to an injury to the endothelium that results in a clot. So if you can't stop the process of trapping ApoB, you're going to get an atheroma. And that cat is going to jump out if you can't shut that trapping down, because the inflammation is just going to start soaring. It's going to be a forest fire. And again, we need to remember a lot of those events are actually microscopic and lead to the chronic diseases of aging. So I get it. The first thing that has to happen to form arterial disease is transforming those smooth muscle cells. The most common trigger for that's oxidative stress. If we can stop that trapping, the fire will be extinguished. We can stop disease. And if you stop it, hey, the body knows how to heal it. You can start removing the cholesterol that's in there and stabilize it. So we published a paper regarding all of this in Frontiers of Cardiovascular Medicine. I do have to let you know it now is in the 95th percentile for reads of all papers ever published by any of the frontier journals. And it's being noted and read throughout the world, not just the United States, because as one of our colleagues stated, and this is really the Rosetta Stone for arterial disease. And actually, as you're going to see in a minute, it really provides the answer for many other things, like how long you're going to live in cancer and dementia. But you can see how the oxidative stress, which comes from all those root causes we mentioned earlier, causes a platelet-derived growth factor increase, causes a smooth muscle cell transformation. And 3 of these root causes you're experts in: sleep, periodontal disease, and the systemic infection that can result from endodontic disease. And as I mentioned earlier, you can have other ways of transforming these smooth muscle cells. And one that I'll point out right now, if you have periodontal disease with PG involved, PG increases something called angiopoietin 2, which also will cause smooth muscle cell transformation. So if you have periodontal disease and this high-risk bacteria is part of the scene, you've got several ways in which you're causing that smooth muscle cell transformation. This is an extended view of that central illustration where you can see the smooth muscle cell eventually ends up causing that atheroma. It drives inflammation. And I want you to note oxidative stress is frequently a two-way street, because what really drives diabetes, pre-diabetes, insulin resistance is oxidative stress. So now if you're wondering, well, I've heard periodontal disease, if you have that, you're more likely to become diabetic. Yeah, no kidding, because that causes oxidative stress. That feeds to insulin resistance. Oh, I've heard if you're obese, you're more likely to become diabetic. Yeah, because it causes oxidative stress, at least pre-diabetes, et cetera. You can do that with all these. So it kind of takes some of the mystery out of that. It also causes hypertension. Autoimmune diseases are much worse. Gut dysbiosis. And when you have increased oxidative stress, you're going to die earlier. You're more likely to get cancer, and you're more likely to get dementia. So by stopping oxidative stress, you not only shut down arterial disease, you help prevent diabetes, you lessen how severe autoimmune disease is, blood pressure comes down, you're going to live longer, you're less likely to get cancer and dementia. So you really need to use oxidative stress as your filter for analyzing any issue. Oxidative stress underpins all the risk factors associated with arterial disease. Okay, now I know how to stay well. Stop oxidative stress. Yes. So I'm going to play a cartoon here that kind of puts a lot of this together for you.
As you've already learned, plaque builds up in the arterial wall. So let's dive a little deeper into how this happens. Oxidative stress is the key factor in plaque formation. Many things cause oxidative stress, such as smoking, poor diet, sedentary lifestyle, stress, but also many diseases like diabetes, high blood pressure, periodontal disease. The cholesterol particles form the bulk of the plaque, In a healthy state, these tiny particles flow right through the arterial wall. They pass first through the tennis court. Remember, that single layer of cells lining all of our arteries. They then go through the intima, then right through the next layer, the muscle layer called the media, and finally through the outermost layer called the adventitia. They then get picked up by the veins and lymphatic system and recirculated. In an unhealthy state, such as sedentary lifestyle, poor diet, poor sleep, prediabetes, periodontal disease, etc., oxidative stress causes muscle cells in the medial layer to get transformed into migratory muscle cells, which produce a Velcro-like substance in the intima. Through electrostatic forces, the cholesterol particles get stuck on this Velcro. The trapping of the particles essentially starts a fire by turning on the immune system in an effort to clean them up. This immune response causes white blood cells to get stuck on the tennis court and then drawn underneath into the intima, where they gobble up the cholesterol particles. When the unhealthy state causing oxidative stress persists, cholesterol particles continue to get trapped, and the white blood cells become engorged with the fatty cholesterol material and transform into what are called foam cells. The foam cells then coalesce into fatty streaks, which go on to evolve into what we call PLAC. This is what we call having a cat in the gutter. If the fire persists, tennis court cells above the cat may die, or the cat may rupture through the tennis court. The body responds to the injured tennis court just like the response you get when you cut your skin. You form a blood clot. This clot may be large, resulting in an abrupt blockage of blood flow. This sudden obstruction of flow causes immediate harm and may be deadly. These big ruptures and big clots cause big issues like heart attacks and strokes. However, the clots may be small and happen with no symptoms. They can break free and travel to the tiniest blood vessels called capillaries. This process can occur silently over and over again until many capillaries are blocked, resulting in symptomatic health issues that we know of as heart failure, dementia, kidney failure, eye diseases, even erectile dysfunction. So big clots cause big problems quickly and may be fatal, and small blood clots also cause big problems, but slowly, leading to decades of chronic disease and significant limitations on a happy, active life. But with laser-focused, individualized action, you can reverse this process to a healthy state at any stage. It's never too late. You can flip the story and live a vibrant, active, independent life with the Arterial Health Assurance for Life program.
So hopefully you like that little cartoon. I think it says a lot. And again, this should be fun and it should be exciting today to realize there is a cure for arterial disease. There's no mystery. You can stop it in anybody. So I'm excited to visit with you. For one thing, you deserve a healthy lifespan. There's no reason you ever need to develop heart attacks, strokes, diabetes, or any of these chronic diseases. Your oral care is critical in achieving the cure for arterial disease, and you can spread this exhilarating message to others. So yeah, I'm excited to visit with you today, for sure. So again, all of these root causes of oxidative stress, and 3 of them are definitely in your bailiwick. So oral health is an essential piece of the puzzle for wellness. It's a vital root cause that is frequently suboptimal. I wanted to share this. This was published about 3 days ago. So they looked at 22,000 patients in Japan, actually, mean age 78, and they assessed their oral health status and wanted to associate that status with disability and mortality risk. And the average follow-up was 3.5 years. So in terms of oral health assessment, that included the number and condition of teeth, periodontal disease, tongue mobility, oral hygiene, dry mouth, mastication ability, and disability was defined as struggling to lead an independent life due to physical or cognitive function. What they found was all aspects of oral health were significantly associated with increased disability and mortality. They concluded to prevent disability and death. This study underscores the importance of routine dental care in maintaining oral health. So your work is extremely important. Don't ever forget it, and don't let anybody shake your tree on that. You're not just creating pretty smiles. You're helping people avoid disability, and you're helping people not die early. So finding sleep issues, periodontal disease, and endodontic disease, it's not looking for a normal sized needle in a haystack. You're never going to run out of business. It's like looking for this kind of needle in a haystack, right? I mean, it's crazy common. The incidence of sleep issues are extremely prevalent. I'd argue the majority of people have some type of sleep issue. And the prevalence of non-restorative sleep, they estimate at least 31% for men and 42% for women. Periodontal disease, you all know better than I do how common that is. It's insanely common. When somebody's 65 or older, 70% of them have it. And then endodontic disease is extremely prevalent too, with a median prevalence of about 52.5%. So let's zero in on the sleep just for a minute. So when you don't sleep well, not only are you driving the risk for arterial disease, but you increase the risk for diabetes, psychosocial issues, gut dysbiosis, hypertension, autoimmune diseases are worse, and you're more likely to develop chronic kidney disease. You're not going to live as long. You increase the risk for cancer, and you increase the risk of dementia. So just think about that for a minute. So when you diagnose one of your patients with a sleep disturbance and you can help them overcome that, you're having a huge, huge impact on their overall health. It's amazing. So, and AHA decreased significantly with MAD, where they looked at MAD devices versus CPAP to treat moderate obstructive sleep apnea. And they found the MAD device did decrease the AHI significantly, and it was as good as the CPAP. And then what was published just recently, the MAD device actually demonstrated a larger reduction in all secondary ambulatory blood pressure parameters compared with CPAP. So those are strong studies supporting the use of a MAD device with moderate obstructive sleep apnea. They are effective, and I'm glad I've got mine. I've got one of the ProSomnus, and I like it. Then what about periodontal disease? Well, we've known since we published this study 7 years ago that high-risk periodontal pathogens are actually causal of atherosclerosis. Those were the high-risk pathogens we identified. That paper has now been cited in hundreds of other publications. And one of the reasons we were able to publish the study, again, is because of the first step. And in our paper, we talk about how PG does increase that angiopoietin-2, which causes a smooth muscle cell transformation, which results in proteoglycans, which results in trapping the lipoproteins in the intima, the first thing that has to happen. And periodontal disease also creates oxidative stress. This study, published in 2021, looked at periodontal inflamed surface area and its effect on oxidative stress. Every standard deviation increase in that, there was a 21% increase in oxidative stress. Well, if periodontal disease creates oxidative stress, is periodontal disease associated with chronic diseases of aging, longevity, dementia, and cancer? Of course it is. Got numerous studies that tell us that. So, periodontal disease definition, in our opinion, does need to include DNA analysis of the bacteria. I'm not going to talk about treatment. It's very complex. I just want to share this one form of treatment that I've been using for over 10 years, which I've found to be very effective for myself and the vast majority of my patients. Those are the PerioProtect trays using the hydrogen peroxide gel. The trays deliver that medication, which has been shown to reduce the number of high-risk anaerobes and decreased, and the percent of the good anaerobes and aerobic bacteria are increased over a 3-month period of time. You can see this blue line's all the bad stuff, and it goes way down. The other are all the good things. So they are effective, and they're also good wound management. They fit all the guidelines for the AMA definition for chronic wound management, reduce the pathogenic infectious agents, debridement, wound compression, and maintenance to prevent the reoccurrence of infection. And then, as I've found and my patients have found, the best side effect you can get is it whitens your teeth. So it's good. Endodontic disease can throw a very powerful punch to the arteries. We've known that with studies that have been published now for over 10 years. This looked at 101 people having an acute heart attack. They found the obstructing clot, sucked it out, also sucked out arterial blood from another area of the body, analyzed those samples with DNA for oral bacteria. The clot had 16 times more of that DNA in it than the arterial blood. 78% of the clots had strep, 35% had the periodontal pathogens. They looked at 9 of the clots under electron microscopy. All 9 of them had bits and pieces of the bacteria. 3 of them had whole bacteria. They did random imaging on 30 of the 101 patients, and 50% of the images showed periapical abscesses. If the patient's clot was positive for strep, they were 13 times more likely to have a periapical abscess. So they concluded dental infection, oral bacteria are associated with the development of heart attacks. Powerful punch. Dental care should be one major element in preventing heart attacks. A similar study done a few years later with 75 patients having acute stroke, where they pulled out the clot, analyzed that in arterial blood. They found 79% of the clots were positive for strep. Only 9% of the arterial samples were. They concluded strep may trigger ischemic strokes. Regular dental care should be emphasized to prevent ischemic strokes. The best tool to find endodontic infection, as you know, is 3D cone beam. Regular conventional radiography is only about 73% accurate. 3D cone beam's 96%. I'm going to play this little cartoon that's done by my partner, Dr. Amy Doneen. I think you'll enjoy it.
The BaleDoneen Method places oral health as a key component to arterial health. We believe our dental colleagues have a key role in cardiovascular disease prevention, appreciating their expertise in periodontal disease, endodontic disease, and airway. These are 3 important root causes of vascular inflammation. Periodontal disease is independently associated with arterial disease. More importantly, high-risk periodontal bacteria is causal of arterial disease. Periodontal disease is a very common bacterial infection, affecting more than half of people 30 years and older, and 70% of people over the age of 50. Periodontal disease is a bacterial infection that can cause bleeding of the gums, inflammation, and even tooth loss. It is an infectious disease because we can spread it to others. Sometimes the infection is obvious because gums bleed, even just a little bit. But sometimes it isn't so obvious because we can't feel or see these bacteria. Interestingly, these dangerous bugs don't just stay in the mouth. They get into the systemic vascular system very easily through things like chewing our food, brushing and flossing our teeth, and even while our teeth are being cleaned. The dangerous high-risk bacteria include AA, PG, TF, TD, and FN. We also care about the health of the teeth, not just the gums. Tooth decay can lead to endodontic infections that often require fillings, sometimes root canals, and even extractions. The main bacteria involved in endodontic disease is called Strep viridans, known more commonly as strep. This infection can also travel throughout the body and can trigger heart attacks and strokes. Dental providers are in a prime position to both assess and treat airway issues. We welcome their collaboration to help diagnose and treat this very common inflammatory root cause. Obstruction of the airway is very dangerous and can lead to heart attacks and strokes. Amazingly, people don't recognize common symptoms of airway issues, which may include poor sleep, snoring, and even uncontrolled high blood pressure. It is critical that patients are properly diagnosed, educated, and treated. The BaleDoneen method considers high-risk periodontal pathogens, endodontic infections, and airway health to be root causes of arterial inflammation. Therefore, we consider oral health to be equally important to other important root causes such as blood pressure and cholesterol. It is critically necessary to make sure you have a healthy mouth. Oral health specialists are critical members of the cardiovascular healthcare team. All patients wanting to establish and maintain cardiovascular wellness must see their oral healthcare specialist regularly, get checked for oral pathogens, get advanced imaging for endodontic disease, and maintain an optimal home care dental program.
So hopefully you enjoyed that little cartoon. So we're going to end with just two cases. One of them is really brief. The first one's not really long either, but just to kind of put all this together. So this was a 59-year-old Caucasian man. He had known subclinical coronary artery disease because he had coronary calcification testing, which was positive. His score was actually quite large at 729. So after that was discovered, he was sent to a cardiologist. The cardiologist did a stress test. He passed it with flying colors. He told him he was fine and did not need any treatment. And that really is crazy. We have data with the coronary artery calcification testing that once the score is above 100, as you see here, even if you only have one cholesterol problem, your risk for a cardiovascular event is basically 30 times higher than average. And this study was done following people for 5.5 years. When you had a score over 400, you were 8 times more likely to be dead at the end of 5.5 years. But yet, because he passed stress tests, they told him he was fine. He didn't need anything. So the Grim Reaper was excited about this patient, I would argue. Well, fortunately, this patient told his old roommate from college about his coronary calcification score, and his roommate was familiar with the BaleDoneen method. So he told him, look, you need to learn about this BaleDoneen method. So this person read her book. He called to make an appointment. He lives in Orlando, Florida, and was given a choice to see me in November in Nashville or sooner in Lubbock, Texas in March. He called in January. So his intuition told him, hey, I think the sooner the better. So he decided to do it in Lubbock. So we had him actually fly to Lubbock 6 weeks ahead of the visit to get all of his testing done, which included seeing an oral healthcare provider that does our method. So he flew into Lubbock 6 weeks ahead of time for that. And if any of you ever flown into Lubbock, it can be a little harrowing like this. I mean, those winds can be strong, but he made it and he got all his testing done. A few weeks later, the second week of February, his labs come back. My nurse sees he's literally on fire. Those fire markers we talked about, his myeloperoxidase is out of sight. 1,221, it should be under 470. Microalbumin creatinine ratio's up, indicating the tennis court's in trouble. His fibrinogen's borderline, PLAC2's borderline, and his CRP, as you can see, is way up, 5.8. So his tennis court's bad. He's got the joker, and his PLAC2 is borderline. So she's really nervous. She knows all about the joker. Then she also sees the dental report. Well, the dental report tells us with cone beam imaging, number 1's abscess, number 20 has decay. All of these healthcare providers do the perioprobing, and he was found to have over 50 points of bleeding, 4 number 6 pockets, 8 number 5 pockets, 25 number 4s. His oral DNA testing revealed 3 out of the 5 high-risk periodontal pathogens. Those are images from this patient. That's his oral DNA report. So my nurse comes to me and says, hey, look, this guy's in trouble. You're not going to see him for a month. What should we do? So I just say, well, if he doesn't see a dentist ASAP, I may never see him. Get a hold of him. So she finally tracks him down. He's at a music festival in Mexico. And she gets a hold of him, says, sorry to bother you, but your arteries are on fire. It appears to be from oral disease. You need dental care ASAP. Oh, thanks, but hey, I feel fine. This is a great music festival. I'll see Dr. Bale next month. If you responded that way, Dr. Bale said to ask you, where should we send flowers and condolences for your death? Said, you are serious? Yes, sir. He seemed quite serious about the matter. Okay, I'm out of here. So he hops on a plane. He flies to Illinois, where his roommate is, who happens to be an excellent dentist. He has his abscess wisdom tooth extracted, and the hygienist begins periodontal therapy. I see him in March, and before I see him, I want to make sure the joker's been taken out of the picture. It was already back down to normal, which we frequently see when it's due to an infected tooth and the tooth is extracted. Myeloperoxidase will crash back to normal, usually in a very short period of time. And that's what Dr. Miller found in his study through University of Kentucky Dental School. So at least when I see him, the joker's out of the picture. We had a great visit. I told him to call his friend and thank him for saving his life. Then we measured the other inflammatory markers again a few months later, and everything's green. Everything's back to normal. The fire's out in his artery. He no longer has active disease, and his disease can start healing. And the Grim Reaper, I'm sure, was not happy. Okay, one last short case. Dreams don't work unless you take action. The surest way to make your dreams come true is to live them. So let's look at another patient that I think strongly illustrates this dream is true. And I want to share with you again this publication that just came out this morning, looking at type 2 diabetes and how they have multiple chronic diseases, and they developed those 20 years earlier in life, and they usually die at least 11 years sooner than other people, because this is a type 2 diabetic. I first had the pleasure of interacting with him September of 2009. At the time, he was 77 years of age. He was a type 2 diabetic and had been a type 2 diabetic for about 30 years. He'd already had heart issues and had stents. When we did his carotid IMT, he had 4 huge cats in the gutter in his carotid arteries that were lipid rich. We worked closely with his dentist. He had periodontal disease, which had to be treated. He had several endodontic infections, which had to be treated. He did have obstructive sleep apnea, which we ended up managing with CPAP and not a MAD device. But he had all 3 of those issues that you're experts in. By the time 2021 rolled around, his carotid IMT showed all of those 4 lipid-rich plaques were totally calcified. All the lipid was out, 0% lipid richness. This is his report from March of this year, March 4th, 2024. You can see at the bottom his plaques. Those really aren't cats in the gutter. Those are tigers in the gutter. He's got a 3.4 millimeter plaque in the left carotid bulb, the internal carotid at 2.9, the right carotid 2.7, the bulb and internal 2.5. Those are monsters. But guess what? There's no lipid in them. They're all classified as echogenic. His disease has been stopped, it's been stabilized, and his current risk for an atherothrombotic event is about 0. What's amazing is he probably is the oldest living type 2 diabetic in the country now, and he doesn't have these conditions. Here's a picture of Ribble. This is on his birthday, which was February 12th. Of this year. He turned 92. He's so mentally sharp, he's still on the bank board. He enjoys his family, which includes his children, his grandchildren, his great-grandchildren, and he has a girlfriend. In my opinion, he would be dead without his oral health care and without the BaleDoneen method. But I think it really drives home. I mean, this is contrary to what should be. And I think it's a strong case to show, yeah, there's no question our method works. You can stop arterial disease in anybody. And when you do that, you not only improve longevity, he's never had cancer, he doesn't have all those chronic diseases of aging, he's never had another heart attack, he's never had a stroke. He's mentally sharp. You tell me. This method works, and your care is critical. This is our common ground. Stop oxidative stress, which will shut down the fire, which will stop the inflammation. Just want to share a couple of quotes that we use frequently with our patients, which I think makes a lot of sense and something to keep in mind. You know, people really don't care how much you know until they know how much you care. That's from Teddy Roosevelt. Do the best you can until you know better. Then when you know better, you got to do better. Leo Angelo. And then for my mother, who was poet laureate for the state of Kentucky, she stated, the saddest case of heart failure is the inability to love. So thank you all for caring about your personal health. The exciting thing is none of you need to suffer from anything we covered today. And for caring about the health of your patients. None of your patients, if they want to plug into this, need to suffer from any of those conditions either. And together we can allow people to have a health span that matches their lifespan. Yeah, is Ribble going to live forever? No, he's not going to live forever. He's going to die someday from something. But isn't it wonderful? He's 92 now, and he's got good health. When we called him on his birthday, my nurse called him. He was in the gym on a stationary bike. But so stay healthy, be kind to yourself. I do want to end with this. We do offer a 3-day course about our method and how to do it, how to apply it. Our next course is going to be October 9th through the 11th in Nashville, Tennessee, which is near where I live now. And I think everyone knows Nashville. It's a great place to visit. So you can have fun at the course, learn a lot, get to know your other colleagues, and enjoy Nashville. And if you want to make a definite decision about coming soon, if you do that before December 31st, the discount is substantial. So it'd be great to see everybody in Nashville. Usually about half of our attendees are from the dental side and about half from the medical side. But thank you very much. I appreciate you having me here, and we should have plenty of time for questions. I'm going to pull back up the little icons here.
Awesome. Fantastic presentation.
Well, thanks. Yeah, it's fun. I mean, when you talk about, arterial disease is arguably the most common pathology in the human body, and there is a cure for it. How can you not be excited about that?
I love it. I love it. I love also that you get so excited with all the passion that you have and are able to share it with all of us. That's awesome.
Well,
I do have
I'm blessed. I feel blessed to be able to do this and interact with other people and affect their lives in a very positive manner. It's a blessing. So, but thanks.
We do have a couple questions in the chat already that I'm going to read to you. And for everybody else out there, feel free to type your questions in the chat and we'll ask Dr. Bale. One of the questions has to do with the case study that you showed at the end with the musician. And we're wondering if that person had any other treatments, or was it simply the infection related to his dental?
No, he had some other root causes that we had to deal with. One of probably the most significant was psychosocial. He had quite a few issues with his family and some of his children, which were very stressful for him. So we had to work with him, make sure he got into good psychologists and got those issues handled. He was obviously also pre-diabetic, but as soon as we corrected all the other stuff, that went away. Pre-diabetes is driven by oxidative stress. So when you control all the other conditions that drive oxidative stress, that insulin resistance is going to disappear. And certainly his periodontal disease, endodontic disease, sleep issues were having a huge influence on that. His psychosocial issues were having a huge influence. He also had hypertension, which we needed to work with, but of course that improved. He needs a little medicine for it, but it improved by controlling all those other things as well. He had a cholesterol problem. He had too high a triglyceride, and we didn't have time to talk about it, but triglycerides, not the other cholesterol particles, but triglycerides can actually cause smooth muscle cell transformation. Oxidative stress before you trap anything in the wall. The other cholesterol particles like LDL cholesterol, it only causes oxidative stress once it's trapped. In its native form, as it's flowing through the bloodstream, there's no oxidative stress from LDL cholesterol. And that's why the ApoB, of course, has always out-predicted LDL by far. LDL, the only reason that really showed prominence, I think, is because that's mainly what the statins clobbered. So it got all the attention. But in its native form, it's not even, doesn't cause oxidative stress, doesn't drive inflammation. Once it gets trapped, okay, yeah, it does. Yeah. But certainly that patient's oral health, in my opinion, those were some of his most significant problems. And if we hadn't corrected that, even if we'd taken care of his blood pressure and his psychosocial issues going on, he would have been in trouble, big trouble. Well, if he hadn't had the tooth extracted, I'm not sure he would have made it to see me in March.
Sure.
He could have had a heart attack or stroke any second. Yeah. Okay. Thanks.
Stuff is serious for sure. I have a private message that came to me that the doctor wants to know if eating a lot of eggs, specifically 5 a day, is truly bad for your cholesterol.
No, you can't say a food like that is absolutely bad. No, some eggs are actually good for people, so we don't prohibit eating eggs. Now, if you're showing a huge cholesterol problem, like your triglycerides are way up, you're eating 5 eggs a day, yeah, we might have, hey, why don't you try cutting that back and we'll see what happens. And the genetics play a big role in that. So we didn't have time to talk about that. We talk about it in our 3-day course, obviously, but your ApoE gene will play a role in how many eggs you might be able to handle a day, because the ApoE gene can influence how well you metabolize fats. Some people are good metabolizers, other people aren't good metabolizers. So there isn't an absolute answer other than to say there's nothing inherently wrong with eating eggs. Eggs can be good for some people. Yeah.
I have a comment from Patty. She says, I'm so lucky to have learned the BaleDoneen Method in 2011 and work in a BD practice in Ohio. The method absolutely works for our patients as well. I have been a dental hygienist for 45 plus years, and it's so wonderful to see our medical and dental communities learn the connection and practice the BD method in their practices. Going to the preceptorship will be the best thing you can do for your own health, the health of your family, patients, and community.
Well, that's nice. Thank you, Patty. Hopefully Barb and Eric are doing well. I know they were excited the weekend before when Ohio State won. That was good. I was rooting for them. I was watching the game myself. I'm glad they pulled it off. But yeah, it's nice comments. Thank you, Patty.
Dr. Bale, I have a quick question. When you mentioned earlier the lab test, the PLAC 2 level exam, is that just in a normal blood panel? And would it show up like that?
No, it's not going to be a standard blood test. The fact is that the cost of it, if you have to pay for it, something like $15. So it's not expensive. But most doctors, I hate to say it, but I think a lot of medical doctors don't even know what it is, much less measure it. And that's despite the fact it's absolutely one of the most important inflammatory tests we measure, because it's not only telling you if there's inflammation in the intima, is there active disease going on, but it is a player in the disease, not just a marker.
Yeah.
So, and again, one of the things that's been proven to cause it to go up is what? Periodontal disease.
Okay, that's good to know, because I already have my lab core pulled up to see if my doctor had.
And some people say, well, I'll just have my doctor order it. Well, that only goes so far, right? If they don't even know what it is, they don't understand it. So, I mean, people really need to plug into a BaleDoneen Method provider if they want to get this testing done and they want to get an accurate read on what it means. And I have to tell you that we're because of COVID, a very positive thing has occurred as a result of COVID. You can always find positives in anything, right? Everything's got negative to it and positive. But the positive thing out of COVID is the BaleDoneen Method now has a telemed program. So we have healthcare providers that you can plug into remotely that do all these tests that will give you an accurate assessment, advice on what needs to be done to stay healthy. If you have arterial disease, how to shut it down. Because in the past, it required, well, you physically absolutely had to come see me or go see Dr. Doneen in Spokane. And that's great if you've got the time and you've got the money to do that. But a lot of people don't have the money or the time to do that. And they still want to apply the BaleDoneen Method, which is great. So we have a way of doing that now that is very recent. And I tell you, it's exploding. There are lots of people who love that telemed program. So if you want the test done, I would encourage you to get the test done, but I'd also encourage you to have it done by a BaleDoneen Method provider, and you can have that done through telemedicine. But what's exciting about all these new publications, all they're doing is reinforcing everything we've been saying for the last 3 decades. It's kind of fun to see.
Mm-hmm. Well, and it looks like if you do go to the BaleDoneen.com website, there is a navy blue button on the top that says telehealth. And
Okay.
the first couple steps are, it looks like some videos that you can watch, but then after you click past that, you can actually, it looks like, get more information about a telehealth visit and everything. So,
Great.
yeah. So
Good. Randy must have it set up where it's relatively easy.
yeah,
It's exploding. We started it recently and he projected like how it might be utilized. And I think it's 10 times his projections now, what's happening.
oh, I bet.
So,
And
you think about it, who doesn't need our method? What person out there is not at risk for arterial disease? I don't know. I don't think there is anybody.
if someone doesn't want to do telehealth, and if they can't find a provider on your provider search area, what tests, or let me see the question, what blood tests would you recommend when they go in for their yearly?
Yeah, well, those inflammatory blood tests are important. And then we have a couple of heart healthy blood tests, which are real important. One of which is called the high sensitivity cardiac troponin. Cardiac troponin is a protein that only gets in the bloodstream when heart muscle cells die. Okay, we all have a few of those die all the time, right? So most people have a little bit of cardiac troponin in their blood. But if you're having silent events, those dangerous silent events that'll lead to all those chronic diseases of aging, guess what? It's going to be elevated. Not to the point where we think somebody's having an acute heart attack, but when it's elevated, it indicates that, you're probably having some silent atherothrombotic events. We need to get to the bottom of that and find out why. And that's, again, a test that no doctor is going to routinely order. The cardiologists don't even like it because they don't know what to do with it. If it's just a little bit elevated, it's like, well, no, they're not having a heart attack. I can't really take them to the heart cath lab. What am I going to do? We love the test because we know what to do. If you're having silent events, it's because you've got unchecked oxidative stress from some source, and you're causing enough inflammation to get those tiny clots forming. So let's go figure it out. We'll find out what the oxidative stress is coming from. We'll manage it and shut it down. So we love the test. Another test is N-terminal proBNP, and that test we nicknamed the heart happy test. It'll go up if there's any issue with the heart, like it's not getting enough blood flow, the valves are malfunctioning, or you're having arrhythmias. So when it's normal, we know with 98% confidence, the patient's getting plenty of blood flow to their heart, the valves are working fine, and they're not having arrhythmias. Huge test. And then, of course, all those inflammatory tests are important.
Awesome. And I know I mentioned it in Dr. Bale's intro in his bio, but he has written a couple of books over the last few years, and that's a great way to kind of, deep dive into all of this too, and goes into much more depth than the 90 minutes that we did today. So definitely check those out. They're awesome.
Yeah, thanks. And that's a good point. I mean, if somebody doesn't want to plug into telehealth, they don't want to come to our preceptorship, they don't want to come see Amy, go see Amy, or come see me or some other provider in person, at least they can get the book, they can read that and gain a lot of knowledge off that. The only caution I would have on that is you never want to be your own healthcare provider. Like Dr. Doneen takes care of me, I'm not going to take care of me. You have to have somebody who has objectivity to manage your own care. So if you've got another dental colleague and they read the book too, and they're on the same page, and they say, hey, I want to work with you, let's do some of these tests on you and let me tell you what I think you should do if they're abnormal, that's okay. But you don't want to be trying to dissect that and manage your own health. That's not a wise thing to do. Now, the good news is Dr. Doneen, in Spokane, she's brought on several new healthcare providers, and she's absolutely set up to take on new patients who want to come to Spokane. And anybody who goes there to see her, they're absolutely going to be thrilled and happy. And sometimes people look at the initial cost and say, wow, that's so expensive. We've never, ever had a person say anything other than after they go through it all, you don't charge enough.
Mm-hmm.
You're not charging enough money. So she's definitely available. And we have some other healthcare providers. At my age, I want to kind of dial back and just stay focused more on the science and keep doing the education part. So I'm not taking new patients, but I have a young BaleDoneen Method provider in Kansas City who's I'm starting to work with, who is willing to see new patients. So if any of you want to go to Kansas City to see this provider, let me know. And right now I'm still overseeing his work. He's been doing our method for 6 years. But if I'm going to kind of hand the baton to somebody, I'm going to oversee their work for a year or two just to make sure, that they are doing a great job. So far, he's doing a great job.
This has been spectacular. We're really lucky to have you, and thank you for sharing all of your knowledge with us. It's amazing.
We feel lucky. BaleDoneen Method feels lucky to have the support of ACT Dental. You got a wonderful group, wonderful people, healthcare providers. And so it's our privilege and honor to be able to interact with you. So we thank you. That's not just coming from me, but my partner, Amy Doneen, and our COO, Randy Kimball. We're all very pleased to work with you. You got a great group of healthcare providers, and we want all of them to stay healthy, to live long lives, and to keep enhancing the health of their patients. So to join hands, it's great.
Awesome. Well, I'll make a quick plug for our December master classes are going to actually focus on perio. So this is a perfect timing, perfect lead up to our December Katrina Sanders part 1 and part 2. So go to our ACT Dental website, register for those, and we'll get more people treating periodontal disease and saving lives. And
That's great.
All right, everybody, have a fantastic Friday. We'll see you next time.
Okay, thanks a lot.